Dr. Lynda Young, will you please come to the podium? Lynda, you have been my partner, my confidant and my friend for the past 2 years. We were the dynamic duo at the State House. You are incredibly wise, and I know you will be a most amazing president. Congratulations.
Thank you. Thank you so much. Thank you, Alice. It has been a great year. We have had a lot of fun, we've done a lot of work, and I have learned an awful lot from you. So thank you very much, and also to my fellow officers here, and I'm looking forward to working with Ron as Vice President this coming year. I also would like to thank the staff, but I know that comes later because I have been working with them very hard already. I'd like to introduce my family that's sitting down here. My husband, Bob Sorrenti, his brother, Paul Cannon, my sister, Marianne Palmer, my daughter-in-law, Annabeth Sorrenti, and my son, Michael Sorrenti. Our other son, John, is on a delayed flight. We'll be here later. He'll just miss everything. So, what can I say? And I'd also like to thank all of my friends and colleagues who are here, and I have to do a shout out to the Incredibles of Chandler Pediatrics, sitting right over there. Thank you so much. This has been truly, and this is truly, an honor. I strongly believe in the idea that we cannot go through life alone. We need each other. We make each other smarter, wiser, and more effective when we work together. That's especially true in a medical society like ours, especially with all of you out here. It is very true. You don't need to be reminded that we live in very complex and interesting times, and the future is less certain than ever. For example, we got a federal health care reform bill last year, but we don't know if it will even be valid when we meet again a year from now. We've had state health reform for 5 years and have learned how to adjust. Our job is to provide guidance as our work changes and to help each other prepare for these changes. Because even if there isn't a payment reform bill, market forces may compel us to integrate and collaborate more than we ever have before. Let's remember, it's never been easy to be in a small practice, and no one ever promised that it would be easy. But for those of us who cherish what the private practice offers, these are very disconcerting times. Some of us Some of us practice in a big teaching hospital in the city, some of us in a solo small office in the country, and many of us are somewhere in between. Wherever we practice, we've experienced the joy of connecting with a patient, of making a difference for that patient and that patient's family. What I love about my practice in Worcester is that I have the privilege of getting to know the children and their families at a very special level. I see them grow year after year, both child and parent. Sometimes there are difficult moments, but when we get through them, it makes the good times all that much better. That's the heart of what we love about the small practice. That's the piece we want to preserve and nurture. No patient cares about our business model. The business model is simply a means to the end. If and when it changes, and we can preserve what patients care about, what we care about, that will be the measure of our success. Patients care about their relationship to us, their interest in getting healthy and staying healthy, and that's what we care about too. That's the essence of what we will protect. Here's my commitment to you. Our bedrock principle is to keep the physician and patient in control of clinical decision making. I agree that health care must be affordable, and I understand that decision making is not a simple matter anymore. But if we lose sight of this central relationship, the physician-patient relationship, we lose health care. Not health care as we know it, but health care itself. Second, we must preserve and respect the great diversity within our healthcare system. There's a reason why there are so many different practice styles and settings throughout our Commonwealth. Patients want them and value them. It's one thing to share knowledge among practices and to try things that have worked with other practices. It's another thing entirely to enforce a uniformity that our patients would not want nor benefit from. Third, physicians must and can lead. We heard that this morning in our educational session with John Nance. Physicians must lead this. Leadership is an art, it's not a science. It requires knowing when to speak, when to be silent. Leadership is expressed through action and example. Sometimes, but rarely, it is expressed by doing nothing at all. Leadership is earned, it's not a birthright. And it doesn't mean leading alone, but in partnership with others. When we as a medical society practice this kind of leadership, we are successful. I would like to conclude with a quote from one of my favorite authors, Dr. Seuss. It's from the book, The Lorax. Like most good children's stories, it's not really just a kid's story. The Lorax says, unless someone like you cares a whole awful lot, nothing is going to get better. It's not. So it's up to us. Every physician in this room, every person in this room is passionate about providing great health care. We have a great challenge and a great opportunity before us. It is truly up to us. My friends, I thank you for this tremendous honor. Let's have a great year together.